and that frees up the whole nail edge. And repeat the procedure on this side. See the portion of nail that's removed with the sharp edge. Usually the little corner on that side is what creates the majority of the problem. Okay, we're going to be performing a phenol and alcohol matricectomy, which is a permanent nail procedure on this patient. Right great toe, both borders of his great toe. So the first step is local anesthetic. We use a mixture of 2% lidocaine plain and 0.5% marcaine plain in order to get long-acting anesthetic. I use an icy cold spray called ethyl chloride as a skin refrigerant to numb up the area. I spray it until it gets nice and cold and frozen, and then I put the injection into the base of the toe, not up near the nail where it would be painful. Then I start to run the injection down along it's called the lateral portion of the toe to the bottom, and we come up a little and we go across the toe, raising the skin a little bit to know that we've infiltrated the anesthesia properly. We get a little more cold spray on this, we call the medial side of the toe, until you see it blanch or become white, and then we run the injected anesthetic down to where we see it pushing out a little like white area down the bottom, so we know we have it. So there's your anesthesia. The second step is to prep the toe, which includes a little bit of a scrub with betadine solution if the person is not allergic. And you get all around the toe, and then you move away from the toe. He's cut out portions of his ingrown nail on his own. You can see the cut in the corner here and the swelling and puffiness here. And we're going to be taking the nail back behind the cuticle, but not cutting the cuticle, to take that out, exposing an area where the nail grows from called the matrix. We're going to put a chemical in there called phenol, which will eradicate that or kill the nail matrix, and then we use alcohol to neutralize that, and then we get out of here. So that's our procedure. Firstly, we'll use this little round object called a toe tourniquet, and we put that around the toe. That'll help cut off the blood supply so that our chemical will work better. And away we go. Take some gauze. This is called a freer elevator. We use this to free up the edges of the nail. And we'll start with this side here. So we go under the cuticle and kind of push forward all the way around. You're going to see a little bit of bleeding occur in those areas. And we go underneath the nail and push forward. That's the part that people don't like to watch. And I kind of push outwards and free up the whole nail edge. You want the nail to come out as easily as possible when you're done. And that frees up the whole nail edge back to the matrix underneath the cuticle in that particular area. I'm going to go over to this side and repeat the same type of motion. You have to determine in advance how much nail you want to take, and that's based on how the nail grows, how curved it is, how much you would need to take so it doesn't grow back in when the rest of the nail decides to come back. And that side is really attached. We're able to free that up pretty good. All right, so most of that's all freed up with that instrument. Now we're going to slide the nail nipper down underneath the cuticle all the way back to the matrix. And then we'll go over to this side. Attached. And we'll take this corner and do the same. I'll get back to taking my freer and I push back to make sure that the nail is cut all the way back to the matrix on each border. Make sure everything is freed. Now I take a hemostat and I will go into the corner way deep and turn and remove that portion of nail that's in the way. I'll turn it and repeat the procedure on this side. See the portion of nail that's removed with the sharp edge. Usually the little corner on that side is what creates the majority of the problem. Now I'll work on getting any extra thick skin out of the area that's in the way, out of the nail grooves. Next I take what's called a curette, which is like a little ice cream scoop with sharp edges, and I go down into the area and try to scrape out and look for any remaining portions of nail or extra skin that isn't needed, and we kind of grab onto that and clear it out so that then any portion of new nail that wants to grow back will have a free channel to grow back. Same on this side. We'll lift out any of the extra skin and I get down into that edge, make sure that all of that nail has been removed. Now, done correctly, if I pull this backwards, you can see some nice grooves created down as a channel down below. And now both areas will be ready for our phenol. This is 89% phenol, which is the chemical that we use, that we dip in. And we go right down into the corner of the nail. We do 3 applications, roughly 30 seconds apiece. Moving this back and forth a little bit to get a good application to the matrix of the nail. Occasionally they'll crumple. Good. Now I use alcohol to neutralize the chemical phenol that was in there. It will stop it from working so that it will limit its effectiveness. Hopefully we did enough to stop any nail from growing in those corners. And so eventually these 2 corners will come up to grow back and the nail will look similar to that without the eaten up edges of the toenail like he has now. So I put a little Silverdene cream, which is a burn cream, on the area, and then we're going to wrap him up. Thank you for watching my video on a phenol and alcohol matricectomy.
What's your name?
Joseph M. LaConte, D.P.M.